Man, if you aren't both exhausted and exhilarated by this day, then you haven't been awake or something. I don't know what's going on. I'm both worn out and I'm also just like, buzzing with energy at all of the different things that we've heard in this room. My name is Deb. I'm a pediatrician. I don't actually like children very much, which is kind of funny. I wasn't going to be a pediatrician. I wanted to be an ER doctor all my life, and I fell in love during my medical school training with kids in foster care. And not just with kids in foster care, but actually with the systems that are trying to serve those kids. And I fell in love with caseworkers and with foster parents and courts and police officers and even district attorneys. And I fell in love with the parents that were struggling too. And it was in the course of working out what that meant in my career that I've landed in the spots that I've landed in. And I have I don't know if it's good to go at the end of the day or not. The upside is if you don't listen to me, if you're taking a nap because you had your cheesecake a little while ago, you already heard a lot of good stuff. So there's not much pressure. On the other hand, I've got a couple of things to say to you and to kind of push on you here at the end of the day. And so I hope that you will give me the grace to do that a little bit. We're going to go pretty fast. We're going to go somewhere, so hang in there with me for a little bit. We've been talking a lot today about ACEs and adverse childhood experiences and toxic stress, but I want to sort of cross that language over with the language of Brene Brown. Who sort of watching Brene Brown? Yeah, we got some fangirling going on in the audience. And Brene Brown is a professor of social work. She did a lot of research in the social work field over the last 15 or 16 or 17 years. She got popular because she did a TED Talk. If you haven't seen anything from Brene Brown, go look at her TED Talk. But she got interested in this idea of people who are brokenhearted and people who are wholehearted and trying to understand what sort of the difference in those is. And it's hard to define what brokenheartedness looks like, but we know what it looks like when we see it with our eyes. We know when it looks like that. We know when it looks like that. And what Brene's research says is that a major cause of staying brokenhearted, staying in that, we all go through seasons, right? Where you lose somebody or something doesn't go the way you thought it was going to go, and we're broken for a moment. But the challenge is what keeps us there versus what allows us to move into a harder place. And Brene's research says a major cause of staying brokenhearted is shame. She defines shame as the pain of feeling like you're not worth anything, that you don't have value as a human, that you're not worth love, belonging, connection, and that you don't have a purpose. And it's associated, interestingly, with very high rates of the same kinds of outcomes that we talk about with ACEs. I think what Brene's talking about is what we're talking about today. Absolutely. These languages go together. And so then the question for all of us is, what do we do about it? And I think a lot of times with the Department of Human Services, and I spend a lot of my time with child welfare staff, and I think a lot of times we think we're trying to sort of super glue people back together, because by the time they run into us, it's already a mess. And the reality is sometimes we're just using paper tape. Have you ever had to use paper tape on something? It's not the good kind of tape. Yeah, this is for people who are like allergic to the good kind of tape, right? And so you put that stuff on and it looks good and it's going to come off easy. The problem is it's not going to stick to anything. And so we're trying to stick people together a lot of times with paper tape, and the reality is some days it's more like a hurricane. And we're just pulling people out of the water. Like, we're not even trying to fix anything. Just getting the bodies out. I love, so let me back up, I guess. I learned about the ACEs from Howard Hendrick. And if any of you have been around Department of Human Services around the state for a while, you know who Howard Hendrick is. And Howard Hendrick led our agency for a long time. And I was taking care of kids at the shelter. I've been 2-3 years serving as a pediatrician for the Polly Mayer shelter in Oklahoma County, where kids came when they didn't have a foster home. And I had a little one-room clinic there. And I saw kid after kid after kid. I saw 25,000 children there over 15 years. And a couple of years into that, I was a young pediatrician. Howard Hendrick happened to be coming through. And I didn't know him very well, but I knew him a little bit. And he said, "Oh, I got something for you, Doc." And he starts digging around and he pulls out this paper. some lecture he'd gone to, you know, on ACEs. And I read the article, and the very next child that I saw was, there were actually 3 little kids in this family. And they were all kind of school-age kids, and they were giggling, laughing, messing with each other. And I asked all the doctor questions. You know, you have medical problems, you take medicine, all this kind of stuff, right? And I asked a few other questions about their family, and I started counting. Because once you've seen this, you can't not count, right? So I started counting, and I looked at the information that the social worker had given me about this case, and I started counting. And the number was kind of rolling kind of high. In the meantime, I'm doing my medical note. These kids are playing, and I'm doing my medical note. And I wrote down on my medical note, I have no concerns. Because that's what doctors write when you don't have when you're not sick today, right? When you don't have any complaints today. I wrote down, I have no concerns. And as I'm counting, I got to the number 7. And I thought that I have a lot of concerns. That's not accurate. But I don't know what to do about it. And it was in those moments that I began to try to understand, what do we do about it? And I love this definition of resilience because it is a very active process of trying to help people return to what they were meant to be. You're not born as a baby with someone hoping that you'll grow up to be a drug dealer or a drug addict or abused or whatever. You're born with a purpose, with a potential, and you get bent out of shape along the way. How do we return people to the shape that they were meant to be? Well, like it is difficult to define brokenheartedness, it's also sometimes difficult to define wholeheartedness, but we know what that looks like too. And hopefully you can close your eyes and you can think about someone in your family or in your friend group that's wholehearted as well. They just kind of leak on people, right? They just leak on you. Like they're just, a lot of times people that they're so comfortable with themselves because they know they have value that they somehow lend you some of theirs. I watch a lot of stuff. TED Talks are like my new thing. You know, the kids are like my kids now. They were telling me something about global warming or whatever. I said, "Where did you read that?" They're like, "Mom, we don't read it. We saw it on YouTube." I was like, "Oh, okay." And so I'm a fan of YouTube and all this kind of stuff. Kelly McGonigal did a great TED Talk on stress that I think is really important for those of us that are in this room. And I love this because she said, your stress response has a built-in mechanism, that's biological mechanism for stress resilience, and that mechanism is human connection. And the reason that matters to me is because every single day, myself and the people that I work with in the Department of Human Services have the opportunity to be in connection with people. And yet, by and large, most of our work is transactional. Most of our work with the community is transactional. And I'm trying to figure out, how do we take the work that we must do, that we are statutorily obliged to do, that it's appropriate for us to do, and turn it into a relational work and not a transactional work? Because I think that is actually what it's going to take for our piece of the wheel. You know, this morning you saw the gears turning and we can be self-healing. One of those gears is around child welfare and human services, and how do we do our services? Well, over the years, I've come to learn, as many of you have, that there's these factors that help people be resilient. And having adults in their life, having a family or a surrogate family or some kind of adult in your life that can connect with you is a significant resilience factor. Realizing that you're good at something, realizing that you fit at school, that even if you're behind, it doesn't matter, just keep going, they'll actually keep teaching you. I had a kid at the shelter one time, she was a junior high. And she had long hair, and I was talking to her about her family and her siblings, and she was telling me all kinds of stories. And when I asked her about school, she immediately dropped her head, and her hair came across her face. And she said, well, I'm in 7th grade, but I'm supposed to be in 8th. And it was there. And because I'm a doctor and I can touch people without getting in trouble for that, I just put my hands, normally you wouldn't like start with someone's neck on their physical exam, but I did, because that way I could move her hair back and get her head up. So I just reached for her neck, moved her hair back, got her head up, and I said, well, you know, let's talk about that. So we talked about it a little bit. Well, she's moved all over creation, been to so many different schools. I said, you know, are you doing okay in school? Like, do you need help? She's like, actually, I do okay if I go for a while, consistently. I said, well, then that's okay. Just keep going. Like, it's okay. Almost all the kids here in this place are behind because their parents move and there's lots of chaos. Just keep going. And she said, I never thought of it that way. Never thought of it that way. Understanding that you can have success in some things, whether that's in education, sports, art, all different kinds of activities that help people both serve as an outlet for some of the things they may be going through and also help them find a voice and something that they're good at is incredibly important. A faith community. This is Little Flower Catholic Church here in Oklahoma City, which is both a community of faith and a hub of social activity for a whole community. Churches don't just serve as a place where people gather to worship. They serve as a place where people gather in community. Often a lot of different kinds of community services are driven out of our faith community. In this state, we can't not talk about our tribes. I love that the base of the ACE pyramid now has the language of historical trauma. Because in this state, if we do not address the idea of trauma in general, without acknowledging the fact that our state was built on basically two groups of people. A group of people who were made to come here, and a group of people who had nowhere else to go, so they came here. If we don't address that in some way, we're going to sort of miss out on the ability to have some kind of an impact. So I think the million-dollar question, I heard people chattering about this in the lobby when we were at lunch and things like that, is, but what do we do? And you're hearing some examples over the course of the day. So what I want to share with you is some things that we're doing. You each in your own space maybe have things to do in your own communities, but I just want to share with you some things that are going on so that you can be understanding where the Department of Human Services is on some of this, and also so that you can start to think about what you can do. In terms of child welfare, there's some things we're doing that are related to this work. One of those is, over the last few years, we've been driving towards the idea that maybe it's better for kids to be with their parents than in foster care. And I know it's a revolutionary thought, but if we could help your family, wouldn't it be better for you to stay there? Not always have people thought that. Not everybody in this room probably thinks that, actually. The dollars don't flow that direction, although maybe that's changing. Often folks have tended to think if your family runs into child welfare, if they're doing something that's abusive or neglectful, it's better for those kids to be somewhere else. And the reality is the evidence is telling us that's actually not the case. Now, I don't mean to tell you that if kids are unsafe, they should stay home. I don't mean that. What I mean is if they're unsafe or we run into them, shouldn't we help them? And part of helping them should be the consideration, is removal going to be more traumatic than whatever is happening in that home if we were to put the right kinds of assistance around it? I was in a meeting not too long ago with Director Lake, who's our child welfare, or our DHS director. And he said, you know, if we could get one thing right, if we could just figure out if the answer to the question when we run into someone is not whether they're safe or unsafe, but whether there's going to be more adversity and more trauma through our intervention than there would be if we didn't intervene or if we involved other partners in assisting. If we could figure out how to answer that question, wouldn't that be a great question to answer? If we could figure out what the ACEs look like because of us, not just before us, wouldn't that be a great question to ask? And so we're trying to ask those questions. I'm not saying it's perfect. We're trying to ask those questions, and part of what we've done is increased the work we do in terms of prevention, the kinds of cases that we can leave at home. The way that we are doing family engagement and not just saying, okay, now we've run into you and so now it's on us, but actually, hey family, you have to come along and be a part of this case, and how can we engage your community? And so we've added over the last couple of 3 years, and I think we have a lot of room to work on these. A very early meeting when we're intervening with a family, a very early meeting that says to the family, bring your people. Bring your people. If you're at a church and you got people, bring your people. If you have family members, extended family, bring your people. If you're already plugged into a service provider, a counselor, or something like that, bring your people. And let's figure out if we can work together to figure out what is going to be needed to keep a child safe. The idea of leaving children with maybe extended family members instead of into traditional foster care. Now that's normal. 20 years ago it was almost unheard of. 30 years ago, if you were the foster parent, they would say to you, don't bond with this child because we don't want you to want to adopt them if they were to come eligible for adoption. And in fact, we might even say they have to move every so often just so you don't get you bonded. So while now this idea of kinship is a common one, it didn't used to be. It used to be. We're also, in a renewed way, I think, focusing on those kids who aren't going to go home. There are some kids in our state whose families just aren't safe. And we can't get there with them in the time that we need to for a child's development and for that child. And so how do we get those children onto some kind of permanent family, so that they are not lingering in our system? This just shows you a little bit of the data that matches what I'm telling you about some of our cases. We've actually doubled the number of prevention type cases that we work. We've also taken to really partnering with a lot of folks to try to improve the number of foster homes that we have. And so many of you may have seen a couple of years ago a big effort, a kickoff effort around Oklahoma Fosters, and you may still see that on social media or different kinds of events. And the idea here was we really are going to make a run at the community, at all sectors of the community, around this idea of having an adequate number of foster parents. Because we are not just trying to put a child in a bed, we're trying to put a child in a family that matches with them and can meet their needs. And we're not there yet. We have made some significant gains, but we're not there yet. This partnership helped by partnering the governor's office, the department, 111 Project, which is a faith-based organization, America's Kids Belong, and trying to say, how can we put some groups together that could actually help us not just find the resource that the agency needs, but find families which children need. Because we need these children to know they have enough value that they don't have to be in a shelter. They have enough value, they don't just have to go here for the night, but you can't stay, you have to move. We've partnered with a number of worked with a number of other kinds of organizations, either directly or kind of indirectly. And I'm just going to throw a couple up, mostly just to make you aware there's a lot of things going on in this community and in the communities across our state that are really good. Say Families is an organization that is really working with trying to identify families who might be able to help a family who's in a crisis, who hasn't, their children are not necessarily in danger, but they could be real quick unless something different happens. And the idea here is some people don't have anyone to call when they need to go to the hospital, or they need to go to rehab, or they lost their home, or whatever. They don't have grandma, they don't have an aunt, they don't have a friend that they can trust. Can we create, in a sense, a community of volunteers, safe, willing volunteers who would actually help out and serve as extended family in that situation? We've partnered, DHS has partnered with an organization called the Care Portal, part of the 111 Project. Care Portal is actually about 3 years old. It's already in 13 states. And this is a connector between child welfare and the faith community. So churches, faith organizations sign up to receive information from us, our caseworkers. If we have needs, we're serving a family, working with a family or foster family, we have some tangible needs. Maybe we're putting some kids with grandma and she didn't have beds for them. We can put those kinds of requests on the Care Portal electronically, and within a radius of where that need is going to be met, messaging goes out to those communities of faith. And the idea here is not just get the bed. The idea here is get the people to meet each other, because they need relationship. Can we have people who live within 10 minutes of each other, right? Start to connect. That's the whole point of this. One of the other organizations or activities that we've been very heavily involved with is Institute for Child Advocacy and Oklahoma Foster Wishes around Christmas. Some of you may see stuff on the news or different things about that. Let me tell you about that. That's not about Christmas presents for kids, foster kids, although it's a good idea to give foster kids Christmas presents. That's a good idea. That's about wish lists where the child has some anticipation that Santa Claus knows where I am. Or somebody out there. I used to have kids that come to the shelter all the time in the winter, December, and they would say, am I going to get any presents because Santa's not going to know I'm here? It's about responding at Christmas time in a way that helps the child know they have value. If the point is to help people know they have value, then everything we do should be framed through the lens of, are we doing that? That doesn't mean we don't do hard things. We do some really hard things. I have sat in my clinic with a parent who was not doing a very good job and said to him, I got to call your caseworker. You're out of line on this. And him cry and hold on to me and say, I know you do. I said, well, let's just do it together. And we did it together. And they took his kids away because he was acting up and he needed some help. He didn't have some of the help he needed. You can do hard things and you can still show people value at the same time. We do it every day with our kids. I told you I don't like kids. I like foster kids, and I have 2 kids, and I love one of them right now. The other one, kind of on the fence, right? He's taking driver's ed today, and he's supposed to get his permit in 2 weeks, and that's going to be dependent on some things. How much I like him in 2 weeks. We do it every day. We hold people accountable, and we love them unconditionally. How is it that we can't figure out how to do this with our neighbors through our work? We're also doing a tremendous amount of work around building community capacity and collaborative work child welfare itself is. And so 4 years ago, there was a decision made by the leadership at that time to begin investing a little bit into community planning and infrastructure development. We can have all these big ideas all we want to, but the truth of the matter is a lot of times there's very, very little planning that goes on in our state that actually prepares communities to be able to do something bigger. And so you have a great idea, it's a flash in the pan, you do something fun for a year and then it's gone. And so the department said we've got to have a better relationship with the community, we've got to be able to do this, and began to invest in a team, and that's actually a couple of years ago why I wound up coming to DHS. Not because I knew anything about planning, just so you know, but because I knew a little bit about the community. And they say, we've got this team, we want to do some of that, and so we've been working with a particular model that uses, it looks like a community. It says if you want to do something around children and child health and child well-being and child safety, can we help you? But you're going to have to do it. The local community has to do it. So civic leaders within that local community are the ones who have to come together and decide what they want to do. And we'll provide some technical assistance and some staff support. But the local community has to own it, because the local community is going to be the one that has to ultimately ensure that it lasts and that it works. I can't come from the state office and go tell 77 counties what they should do, any more than I can tell 77 child welfare offices what they should do. So much of this work has to be done in the local community, but with the supports, technical supports and things like that we can offer. So right now we have community collaboratives occurring in Potawatomi and Lincoln, Oklahoma County. Some of our partners are in the room. I've been seeing our partners throughout the day, and there's some fantastic stuff going on around things like coordinated school health teams out in Pot County. Education and those teams were a big focus. Employment and skill building in Lincoln County, transportation as well. And then in Oklahoma County, a number of different activities around youth and also around how we do work early on in a child welfare case with families through the family tree, which is the sort of new repurposed version of the shelter. That same shelter I spent 15 years in, saw all those kids in. One of these days will open as a place that serves families so that either they don't have to lose, hopefully that they don't have to lose their kids, or if they do, right now, working with children and families who are involved in the foster care system, they can return home sooner, in better shape. We should leave people in better shape than we found them. And that's what we're going to do in that same building. We're building, doing some work with tribes. We have a large project going on right now between the Court Improvement Program, ourselves, Child Welfare, and the Oklahoma Indian Child Welfare Association around how do we improve ICWA practice. And this is less about improving ICWA practice and more about improving the relationships, the work we do around Indian families, and the relationships between our agency and tribes as we do that work. Well, I want to push you a little bit. This is a day, it's a fun day, and it has felt really good to be here. Really good. I have absolutely enjoyed every single minute of it and seeing so many friends, and there's so much excitement in me about what this state could look like. But we have a couple of elephants in the room that we need to talk about. I don't know if you guys are familiar with a book or a philosophy called The Tipping Point. But The Tipping Point is Malcolm Gladwell, and it's the idea that the right people doing the right kinds of things together at the right moment in history can really create a massive social change, way bigger than any of us can sort of typically imagine. We tend to measure things in increments, and I want to measure stuff in exponents because I'm tired of increments. Malcolm says the tipping point allows you to do that. The right people, the right time in history, the right activities. I think the question I'm struggling with in my own agency is, could we build a child welfare system that is a system of resilience through which when people pass, it actually gives them opportunities to bend back the direction they were meant to be. That when they come out the other side, regardless of the legal outcome, because there's going to be times when the legal outcome is that you're going to have your rights terminated on your children. And there's going to be times when the legal outcome is that kid spends a year and a half in foster care and then they go home and somebody's going to lose in that court case. Foster care is not a win and a lose. It's a lose and a lose most of the time. But could we get, as people pass through, whether those are foster parents or biologic families or children or caseworkers or partners, community partners, when we get on the other side of that, could we actually leave them in better shape than we found them? Because that would be what a system of resilience would do. Well, I think we're in the right time for that. I think we have the science of ACEs, of stress, resilience. We're starting to put some sort of meat on the bones of this thing. We have better mental health care, medical care. I'm sorry, I'm getting stumbling over the mental health. Because now I have to say brain health. This is Dr. Block, you messed me up.
Thanks, Block.
We've been in about 5 years of significant child welfare improvements. We still have miles to go, don't get me wrong, but the child welfare system is very different than it was 5 years ago. We're in the right time in history in Oklahoma to do this. I think it's the right place because I think Oklahomans, while we get put all over the news as the dead last in all the categories we'd like to be at the top and dead first in the categories we'd like to be at the bottom, there's a lot of good people in this place. And I think under the right conditions, those people will come together. We've done it. We've had bombings, and we've had tornadoes, and we've had unbelievable things happen in this state. And I've watched people come together. All it takes is coming together around this in a sustained way. I think we're the place of resilience. This conference, I think, is a piece of that. The question is this: are we going to be the people of resilience? And here's what people of resilience, I would argue, look like. Based on what Brene Brown says, I think you have to be people who are full of integrity. You have to tell the truth. You have to be compassionate and vulnerable in the right ways. We have to be considerate and willing to listen to each other. There's a lot of talking that goes on, and there's not very much listening these days. All you have to do is get on Facebook for about 5 minutes if you did that at lunch, and you saw a lot of people with their opinions about whatever. We've got to start listening. And we got to speak the truth. And I'm going to unpack that for you in just a minute. And I know I'm like supposed to be like the church girl. I don't know. That's my title. Like about faith. I'm so sorry. I hope it doesn't offend you. This is important foundational understanding for you. Okay. The people who serve, people who have high ACEs, by and large. Okay, across the population. Higher ACEs than the general public. One of the problems with becoming a system of resilience is our system is full of people who are themselves brokenhearted. We're going to have to figure out how do we serve our own people before we can serve, or at the same time we're learning to serve other people. And there's literature now that says the health of the child welfare system is directly connected to the outcomes of the child welfare system. Quality practice is maybe less about what we do and more about who we are when we do it. Here's the other thing that's interesting. A lot of people are talking about secondary stress, secondary traumatic stress. There's also evidence that secondary traumatic stress is actually less stressful than working in systems and with coworkers and with partners that are behaving in ways that are toxic or unethical. It's not the work, it's not the terrible stories I have to hear every day that drives me crazy. Man, I need rest from those things sometimes. But it's when I feel like there's other people who aren't doing their part. Or maybe there's other people who should be playing with me and they're opposing me. That's what makes me crazy. And I know some of you guys are the same way. You're like, yeah, it's your caseworkers that are making me crazy. I know. I get it. Goes both ways. We better figure out how to deal with that. or else, this is a lot of fun day, it's a lot of talk, but we won't get where you want to go. So Brene Brown cites a guy named Harry Frankfurt on this idea of speaking truth to bullshit. There's apparently a whole scientific body of work around bullshit. I think it's funny. There's a book and everything. But Harry says this: someone who lies and someone who tells the truth are playing on opposite sides, so to speak, in the same game. Each responds to the facts as he understands them, although the response of one is guided by the authority of the truth, while the response of the other defies that authority and refuses to meet its demands. The bullshitter ignores these demands altogether. Now let me tell you what this looks like. Let me just give you a couple of examples. Truth is kids have value. False, lies, and untruth, kids don't have value. Right? We can agree on that one. That's pretty simple, right? Kids are valuable or they're not. Okay? Bullshit is you're valuable as long as you behave. You can stay in my foster home if you behave. You can stay in my classroom if you follow the rules. And I'm not saying there's not kids that don't need help, and we don't have to, I'm not saying any of that, okay? But I'm just saying when we place a child's value in their behavior, that's not even the truth or a lie, that's just yes. Let me give you another example. The truth is, I was thinking about this question that came up at lunch around how would your system change if we had lower ACEs in our community? The truth is, we're all going to say we want lower ACEs in our community. We'd love it if no one had to go through these things. I think we all kind of agree on that, okay? A lie would be, or the opposite of that would be, nah, just, let everybody have 10. The bullshit piece of that is we can say we want that, but the reality is when the rubber meets the road, if we're going to lose employees over it, or we're going to have to change jobs over it, or we're going to have to shift staff from this job to that one because we're not going to do so much of this anymore because we're going to be over here doing this other thing, people get real nervous. The truth is, we have so many nonprofits in this state. If we spent half as much time with half as many of them we could do twice the work. People spend all day with little nonprofits trying to make sure they get the reports for their board and keep everybody happy and all this kind of stuff instead of being able to do the work we're supposed to do. Well, we can say we want to reduce ACEs, but the reality is we have to live it, and sometimes that living it is going to have some pain associated with it. And the question is, are we going to be willing to speak truth to that? Let me give you one more. Mr. Nixon's going to pull me off the stage. One more. Truth is, Faith Community has a book they follow. And it may be a little bit different books depending on which faith community you're in, but they all have a book. That's the truth. Right? They'd say, these are the rules, or these are the guidelines, this is how we live. False, lie would be, that thing doesn't matter. It does matter. Lie would be, spirituality doesn't matter. Okay? Bullshit would be, we're going to read the parts of the book that we like, but not the parts that say we should actually help people. Faith community has come along in this space a lot over the last 5 or 6 years. There's miles to go. I'm so glad to hear that there is effort underway to specifically engage faith leaders around ACEs and this issue, because I believe with all my heart, if we don't have the faith community as a pillar to responding to adversity in our community, we're not going to get very far, because the church and the faith community are often the carriers of purpose. Remember Brene Brown said, you believe you have value, you believe you have purpose. Purpose a lot of times comes in that space. The hard part is right now we do a lot of these things not with civility. We do it actually on Facebook, right? Or Instagram or whatever. And Brene Brown also cites the idea that incivility is a problem too. That traumatizing each other in the course of saying we're doing something good is not great. If you don't believe that, I want to tell you what it was like. In the building where I work, in the state office, DHS, didn't feel happy the day that a legislator said people who work for DHS are terrorists. That's incivility. And it's not acceptable, and it causes us to not collaborate, and it causes us to not feel safe, and it causes us to not be effective. And we've got to figure out how to tell the truth, speak the truth to each other, and do it in a way that is civil. Because civility, as a practice, whether it's with the people we serve or whether it's with each other as partners, promotes respect and generosity and resilience. So as you wrestle with the stuff you've heard today, I would just encourage you, appreciate it, be happy about it, but don't not wrestle with whether we are willing to pay the price to tell the truth, but do understand if we do it in the right way, if we partner in the right way, and we're honest with each other, and we're vulnerable with each other, we will change the face of this state in a very short amount of time. Thank you.
My name is Reverend Mary Gudrow, and I am also a licensed professional counselor, and I work with Oklahoma Conference of Churches, which represents about 700,000 Oklahomans in our neighboring denominations. And I want to first of all thank you so much for recognizing the importance of the faith communities. I lead a team of about 170 clergy from about 32 denominations and interfaith partners that respond to trauma in disasters, as well as other crisis events. And what I can say for sure, and I appreciate again so much what you said, is that especially in rural areas, those clergy are on the front lines. They are the first ones to be able to address some of the issues, and maybe the only ones, especially if there's perhaps a shortage. My question for you is this. You presented so many wonderful points, and I want to package it all and just package you and take you to talk to all those clergy. My question for you is this. If you had one thing, the first thing maybe that you would want to tell those clergy who are learning about ACEs and wanting to learn how to respond, what would the first thing be that you would want them to know?
Oh, that's good. I don't know. I have to think about it. But I will tell you this. My dad's a pastor. So this whole idea of like the faith community is very near and dear to my heart. I didn't know anything about child welfare growing up because we just took care of people. We were in a rural church. We knew who was in trouble. We knew who was fighting because they came to our house for marriage counseling. We knew who needed help and who needed food and whose kids were left alone. We knew all that stuff because they often, those people were at our house on a regular basis. And so we knew that. I think, in my mind, I think one of the things that is important for clergy to understand is that language in Scripture about the poor and the oppressed, that language matches what we are talking about in science, what Brene Brown was talking about in terms of brokenhearted. So I think it's really important for us to figure out how do we translate the scientific principles or the social services principles into language that reads for a minister and what they're supposed to do. I think a lot of times churches think that evangelism is inviting people so they can grow their congregation. And the truth of the matter is maybe some of the best, if you're wanting people to be exposed to the thing that you believe, and as a leader, a church leader, you're interested in evangelizing, one of the best things that you can do is actually help someone. Because then they're going to listen to you. And so getting that idea of evangelism and a language of Scripture and kind of figuring out how to translate what we're doing into a language that ministers will kind of latch onto, in my mind, is one of the early wins for us.